Hi everyone, welcome to PMHRN, where we specialize in helping psychiatric nurses prepare for the ANCC PMHN Board Certification exam. I'm Alison Miller, and this is 5 Pitfalls to Avoid. Pitfall number 1, inadequate preparation. I've taken this exam, so I can tell you, it is fair, it is well written, and it is manageable. But it is not easy. Most folks need to do quite a bit of studying to pass the exam the first time. I certainly did. And it's not unusual for folks to spend a few months preparing for it. So don't rush your studying. On the other hand, don't stretch your prep time out over a year. By the time you reach your test date, you'll have forgotten some of the finer points you had learned earlier. 3 to 6 months of studying should be plenty of time. But what exactly should you study? Well, PMHRN has organized all the important topics into one online exam prep course. Divided into 4 distinct sections, it provides you with 73 lessons on crucial topics you need to know to pass the exam. It also provides you with 40 practice questions that are thoroughly discussed with each answer option thoroughly considered. Another useful resource is Kim Hutchinson's exam prep book. It usually runs about $85 on Amazon. It's very comprehensive, and it has 40 practice questions with answers and rationales in the back. Just be aware that since the exam's update in October of 2019, the 5th edition is no longer 100% current, and there is no 6th edition out yet. But the material on topics such as diagnoses, brain chemistry, and medications is still rock solid, so I think you'd do okay with this if you're an avid book reader who likes highlighting and note-taking as a study method. PMHRN also has 2 other exam prep resources. A recently expanded 67-page workbook, which includes things like the compare and contrast grid of all the important developmental theorists, vital information about psychotropics and their side effects, definitions of psychiatric and research terms, best practice care for LGBTQ patients, and key points to know about culturally sensitive care, among other topics. And a set of 97 exam prep study cards for those who like to study just one piece of information at a time. You can get more information about these exam prep products on our website, PMHRN.com. But in all honesty, the most important part of your prep is going to be practice questions. Practice questions and their rationales are rich with information. ANCC offers a free set of practice questions for this exam, and I strongly recommend that you go through that practice exam over and over again, not just to learn the material it contains, but more importantly, to get the rhythm of how these questions are asked and how you should work through your answers. Here's the link to those questions. Pitfall number 2, test anxiety. You know that experiencing some anxiety around this test is perfectly normal. In fact, it's helpful because it motivates us to study and pay attention. But an awful lot of nurses have more than the normal amount of test anxiety. Enough, in fact, to prevent them from even considering sitting for this exam, much less to start studying for it. The anxiety can also show up as procrastination. Sure, you've gone through the course 4 or 5 times, but you don't think you should schedule your exam date until you've gone through it just one more time. Yeah, trust me, this will not serve you. Folks, the time has come to slay this particular demon, and you want to do so well before the day of the exam, because crippling anxiety will mess up both your recall and reasoning skills. Look, you're a professional. Failure is something you've occasionally experienced before, and you survived it. But it's important to keep in mind that success is something you experience every single day. In fact, you have much more experience in succeeding than you do in failing, so take stock in that. But it's also true you might not pass the first time. The good news is nothing really awful happens if you don't pass this exam. Your ego might feel a bit bruised, and that's it. You can retake it in a couple of months. So forge ahead bravely. Don't let this mere emotion slow you down from reaching your goal. Pitfall number 3, taking too much time to answer each question. This exam is 150 questions. 125 of them count towards the grade, and 25 of them are being field tested for validity. Which ones count and which ones don't? Only the computer knows for sure. So you have to read and answer every question with total focus. Where some nurses get tripped up is in how much time they spend on each question. We only get 3 hours, or rather 180 minutes, to finish the exam. This means we have roughly 1 minute per question, with 30 extra minutes for taking a short break in the middle and reviewing our answers at the end. To keep pace, my recommendation is that you look at the clock just as you are about to start the exam, and then on the scratch piece of paper they give you, write down what time it will be in 30 minutes, 60 minutes, 90, 120, 150, and 180 minutes. At the 30-minute mark, you should be somewhere in the vicinity of question 30. At the 60-minute mark, you should be close to question 60, and so on. This way, you can be absolutely sure you are on schedule. And if you are falling behind, well, you can gently remind yourself to be a little less OCD with each answer. Pitfall number 4, not taking enough time to answer each question. True, going too slowly may mean you run out of time, but going too quickly is just as risky. Don't let your test anxiety make you fly through the exam just because you desperately want to get out of there. I know it sounds cliche, but it really is important to remember to breathe. Take a moment to roll your shoulders, mobilize your neck, then draw in a long, slow breath, hold it for 4 counts, and then gently let it out. This really will help you slow down. If you're one of those fast readers who can whip through exams with plenty of time to spare, you'll have the luxury of going back over every question to make sure you read and understood it correctly. Double check for accuracy of your comprehension and also that you marked your answer correctly. Catching small oversights like this can really make a difference in your final score. Pitfall number 5, not rehearsing enough. Answering as many practice questions as you can will be your secret power, believe me. The more you do, the more fluent you'll become in this PMHN test language. For instance, let's look at this practice question. A 32-year-old patient has been brought to the ED via EMS after his father reported finding the patient lying in bed, covered in sweat, and in a delusional, agitated state, shouting repeatedly that he was the king of the Prussian army and must go to battle. An empty bottle of haloperidol was found by his bedside. Current vital signs are temperature 104.4, blood pressure 184/96, pulse 122, respirations 20. Okay, let's stop for a moment and pull together what we know from this scenario. First, his father reports the patient being grandiose and delusional, and that the patient has been prescribed Haldol. So it's safe to assume that he has some kind of thought disorder. But his vital signs are lousy. He is quite hypertensive and febrile, and diaphoretic and a little tachycardic. Also, the bottle of Haldol is empty. We don't know yet if he's in this state because he ran out of medication or because he's taken too much of it. So let's consider, what kind of symptoms would running out of medication cause? Well, the patient's delusions would certainly fit, but his vital signs indicate something more is going on here. On the flip side, what kinds of symptoms would too much Haldol cause? Well, an overdose would cause neuroleptic malignant syndrome, which would include being febrile, diaphoretic, and hypertensive. This process you and I just walked through is a perfect example of what ANCC means by testing your critical thinking skills. Basically, they want to see if, first, you are a good detective, able to piece together all the clues they give you and to make a deduction, and second, if you know what the correct intervention would be based on that deduction. So let's look at the possible answers to see if we can figure this out. Nursing interventions should include A, getting an order for a beta blocker to bring down the patient's heart rate, B, placing the patient in restraints to maintain the patient's safety, C. Providing medical support such as ice packs to his underarms. D. Getting an order to restart the haloperidol to address the delusions. Even if you have no idea what the correct answer might be, you can easily strike one of these answers right off the bat. B. Putting this patient in restraints. There is nothing in this scenario that indicates that the patient is in danger to himself or others. So, let's get rid of B. Right there, we've improved our chances from 25% to 33%, even if we just guess at this point. Since this may be neuroleptic malignant syndrome, we want to ensure he receives no additional neuroleptics until it's been ruled out, because more medication will only put him in further crisis. So we can strike D from the list of possible answers. Let's look at these last two remaining answers. Is his heart rate dangerously high? Not really. I wouldn't want him staying there indefinitely, but I'm not seeing the dire need for a beta blocker just yet. Still, before we rule it out entirely, let's look at the other possible answer, answer C. Now, this is a 32-year-old man whose temperature is 104.4. That's awfully high for a guy that age. And a fever of 104.4 is far more dangerous to him than a heart rate of 122. So medical support is called for. So the correct answer is C, providing medical support. Avoid these 5 pitfalls, and this is what you will feel like when you crush this exam.